on your side. Straighten the bottom leg out. And I'm going to rotate again the lumbar spine. Do you have any pain here?
Nope.
I'm going to rotate her again above the elbow, not here. Rotate her, iliac crest, 4-5, down 1, 5-1, until the lumbar spine is in rotation, so I limit motion in the other planes. So when I work in the sagittal plane, there's less available motion. My forces will affect mainly the SI. So I want to be in the SI joint. Find the PSIS. Come in just medial. I'm now going to rest the knee on the upper thigh, and I'm going to come to through the hip to the feather edge. And then with a joint technique, I'm going to go a little bit beyond the feather edge. With a thrust, I'm going to really lock it up. This is graded non-thrust mobilization. So I'm going to come up to the restrictive barrier. I want to feel the restrictive barrier just a little bit more. So I feel it, drop the knee down, and now the thought is, I've got two joints here. We've evaluated those two joints with the stork and the reverse stork. If I want to affect the upper more than the lower, I mean, you're not going to totally affect one without affecting the other, but I can bias my forces more towards one. I'm going to come in here, ASIS, PSIS, and I'm going to rotate her innominate posteriorly, like that. I'm going to give it a little turn. Now, I would suggest, if you can, some of you will do this. You'll pull with your biceps. I would rather you push with your triceps. You have to be tall enough to get over the patient. And then it's grade 1 to 4 on the innominate. If I want to affect the lower pole, I'm going to be on the ischial tuberosity. Do you mind?
Yep.
Okay. Ischial tube, ASIS, and now I'm affecting the lower pole, grade 1 to 4. Early range, mid-range, end of range back, end of range oscillate. No more than 1 to 2 minutes. If you're in the beginning, maybe 30 seconds to a minute, just to see how it reacts. You never know how these joints are going to react. Alright, so find the barrier, upper pole, PSIS contact, hypothenar, ASIS contact, palm, and turn the wheel. Come in lower, turn the wheel, lower joint. Some people feel there are more restrictions at the lower pole. If you're not sure with your stork test, come in here and do a little spring. Spring, spring. See where the end feel is stiffer. All right, let's try that.